Your doctor has probably told you to watch your sugar intake carefully, take your medications consistently, and check your blood glucose regularly to manage your diabetes effectively. But here's what often gets overlooked in those conversations. Without specific essential nutrients, your insulin simply won't function as efficiently as it should. Your nerve tissue becomes more vulnerable to damage, and complications can develop faster than they would otherwise. I'm Dr. Thompson, and today I'm going to walk you through 3 critical vitamins that most people with diabetes are deficient in, often without realizing it, and show you exactly how to address those deficiencies through strategic food choices and, when necessary, targeted supplementation. Here's what many people don't understand. The chronic fatigue you're experiencing, the persistent muscle aches, the frustrating inability to get your blood sugar under control no matter how carefully you eat, these symptoms might not just be part of having diabetes. They could be signals that your body is missing something fundamental it needs to function properly. The fascinating part is that addressing these nutritional gaps can create measurable improvements in how you feel daily and how effectively you manage your glucose levels. These aren't obscure nutrients you've never heard of. These are well-researched vitamins with specific documented roles in insulin function, nerve protection, and metabolic health. But diabetes changes how your body processes, stores, and uses these nutrients, which is why deficiency becomes so common even when people think they're eating relatively well. Before we dive into which vitamins matter most and how to ensure you're getting adequate amounts, I'm curious, where in the world are you watching from right now? Drop your city or country in the comments below. It helps me understand the global community we're building here, and it reminds all of us that managing diabetes is a challenge people face everywhere. Now, if you find this information helpful, please consider subscribing to the channel. It genuinely helps support the work we're doing to provide evidence-based health information. Let's start with the first critical vitamin. Vitamin 1, vitamin B6. Most people don't give vitamin B6 much thought, but if you're managing diabetes, this nutrient deserves significantly more attention than it typically receives. Here's what happens metabolically. When your blood sugar runs elevated, your kidneys work overtime trying to filter excess glucose. In that process, they also flush out water-soluble vitamins, including B6, at a faster rate than normal. You're literally urinating out nutrients your body desperately needs. On top of that, the chronic inflammation and oxidative stress that accompanies diabetes forces your body to consume B6 at an accelerated rate for cellular repair processes. High insulin levels, whether from your own overworked pancreas or from medication, can interfere with how your cells metabolize and utilize B6 at the cellular level. And here's where it gets even more complicated. Certain medications commonly prescribed for diabetes management actually deplete B6 further. Metformin, one of the most widely used diabetes medications, gradually reduces B6 levels over time. Many blood pressure medications do the same thing, which means countless people with diabetes end up functionally deficient without having any idea why they're experiencing certain symptoms. The challenging part about B6 deficiency is that it doesn't always announce itself with dramatic, obvious symptoms. The signs can be subtle and easily dismissed as just part of getting older or just part of having diabetes. If you're experiencing persistent, unexplained fatigue, the kind where you feel exhausted even after adequate sleep, low B6 could be contributing. Brain fog, difficulty concentrating, or mood disturbances like increased irritability or low mood can all stem from inadequate B6, since this vitamin plays crucial roles in neurotransmitter production. One of the most significant warning signs for people with diabetes is nerve-related symptoms, tingling sensations, burning feelings, or numbness in your hands and feet. Muscle weakness or coordination difficulties can also develop, since B6 is absolutely essential for proper nerve and muscle function. Skin changes are another indicator: dry, flaky, or persistently irritated skin, especially around the mouth and nose, frequent mouth sores, or a swollen, inflamed tongue, a noticeably weakened immune system where you seem to catch every illness that circulates. In more severe deficiency cases, B6 shortage can even contribute to anemia, causing dizziness, unusually pale skin, and shortness of breath with minimal exertion. What many people don't realize is how broadly B6 deficiency affects multiple body systems simultaneously. For fertility and reproductive health, inadequate B6 can reduce testosterone levels and sperm quality in men, while women may experience irregular menstrual cycles and worsened premenstrual symptoms. Sexual function often declines because B6 helps regulate dopamine and serotonin, neurotransmitters that control mood, energy, and libido. Your nervous system relies heavily on B6 for nerve repair and protective myelin production. Without adequate levels, existing nerve damage worsens, pain intensifies, and recovery slows considerably. Kidney function becomes more compromised because B6 helps combat inflammation in kidney tissue. When levels drop, the risk of diabetic nephropathy complications increases. Eye health suffers as well. B6 helps protect the delicate blood vessels in your retina, and deficiency can accelerate diabetic retinopathy progression, leading to vision deterioration. Cardiovascular health takes a significant hit. B6 helps lower homocysteine, an amino acid that damages arterial walls when elevated, and reduces risk of high blood pressure, heart attacks, and strokes. When B6 levels fall, blood vessels become stiffer and less flexible, worsening circulation problems. At the cellular and metabolic level, B6 is absolutely essential for proper glucose metabolism. It helps break down glycogen, your body's stored form of glucose, so energy gets released steadily instead of creating dramatic spikes and crashes. Without sufficient B6, blood sugar becomes significantly harder to manage and insulin resistance tends to worsen. B6 is also critical for neurotransmitter production, which explains why deficiency often leads to anxiety, mood instability, and depression. It's needed for hemoglobin production, which carries oxygen throughout your bloodstream. Without adequate B6, your cells don't receive enough oxygen, leading to profound fatigue and slower wound healing. So how do you ensure you're getting enough? Food sources should be your primary strategy. Chickpeas are one of the richest sources available. Just 1 cup of cooked chickpeas provides approximately 55% of your daily B6 requirement. Beef liver is another powerhouse, delivering around 50% per 100-gram serving. Wild-caught salmon provides roughly 40% per 100 grams, making it an excellent protein choice that also supplies omega-3 fatty acids. Turkey delivers about 40% of daily B6 per 100-gram serving, and sunflower seeds offer approximately 30% per 1 ounce, 28-gram serving. These foods don't just help maintain adequate B6 levels, they simultaneously support nerve health, immune function, and overall metabolic efficiency, making them particularly beneficial for people managing diabetes. If you enjoy preparing more elaborate meals, certain gourmet dishes are exceptionally rich in B6. A Japanese-style miso-glazed salmon served with chickpea puree, 180-gram salmon, half-cup chickpeas, delivers over 90% of your daily B6 needs while also supplying heart-protective omega-3s. A French-style beef liver pâté with roasted garlic and potatoes, 100 grams liver, 1 medium potato, provides around 85% of daily B6 along with iron and B12 for improved energy and red blood cell production. A Mediterranean chickpea and grilled lamb stew with saffron, 200 grams lamb, 1 cup chickpeas, delivers approximately 80% of daily B6 while offering essential amino acids for muscle repair and immune support. If dietary intake isn't sufficient, supplementation becomes important. The most bioavailable form of B6 supplementation is P5P, pyridoxal 5-phosphate, which your body can utilize immediately without requiring conversion. Thorne Research P5P, 33 milligrams per capsule, is one of the highest quality options available, with excellent absorption and specific support for nerve function. Another solid choice is Pure Encapsulation's vitamin B6, 50 milligrams per capsule, which provides a therapeutic daily dose. Most people with diabetes do well with 25 to 50 milligrams of supplemental B6 daily, but if you're considering higher therapeutic doses, it's important to consult with your healthcare provider first. Certain foods and habits can actually worsen B6 deficiency, so awareness matters. Refined grains like white bread, white pasta, and white rice lose most of their B6 content during processing, so avoiding these and choosing whole grain alternatives helps. Diets high in added sugars burn through B6 at accelerated rates because insulin spikes increase your body's demand for it. Alcohol consumption is particularly problematic. It interferes with B6 absorption and increases breakdown of existing B6 in your liver. And remember those medications we discussed. Birth control pills, metformin, and many blood pressure medications gradually drain B6 over time, which means actively replenishing it through food or supplements becomes essential. Vitamin B6 might not receive much media attention, but for people with diabetes, it's genuinely transformative. It helps insulin function more effectively, protects nerve tissue from progressive damage, supports cardiovascular health, and keeps energy levels stable, making it one of the most important nutrients for comprehensive diabetes management. Vitamin 2, vitamin E. Think of vitamin E as your body's natural protective shield, defending your cells, nerve tissue, and blood vessels from oxidative damage. But here's the metabolic problem people with diabetes face. You burn through vitamin E significantly faster than people with normal blood sugar. Elevated glucose creates substantially more oxidative stress throughout your entire system, meaning your body must consume more vitamin E continuously just to neutralize that damage. And since vitamin E is a fat-soluble vitamin, it requires healthy dietary fats to be absorbed properly. But diabetes often disrupts fat metabolism, making it even more challenging to maintain adequate vitamin E levels even when you're consuming it regularly. The challenging aspect of low vitamin E is that deficiency symptoms often develop gradually and can be easily attributed to other causes. Early signs might include muscle weakness or difficulties with physical coordination. Vitamin E is crucial for nerve function, so when levels decline, the electrical signals between your nerves and muscles don't transmit as efficiently. Numbness, tingling, or burning sensations in your hands and feet can intensify, making existing neuropathy considerably more painful and disruptive. If your skin feels chronically dry, irritated, or slow to heal from minor cuts and abrasions, inadequate vitamin E might be contributing. Vision problems like difficulty seeing in low light conditions or increased eye strain can be red flags, since vitamin E helps protect the tiny, delicate blood vessels in your retina. And if you find yourself catching infections more frequently than usual, that could indicate compromised immune function related to low vitamin E. Vitamin E deficiency can affect virtually every major system in your body in measurable ways. It significantly impacts fertility and reproductive health. Vitamin E is essential for healthy sperm and egg production. In men, low levels reduce sperm quality and motility, making conception more difficult. In women, it can disrupt hormonal balance, causing irregular cycles or pregnancy complications. Sexual function often declines because vitamin E improves blood circulation, absolutely critical for healthy sexual response in both men and women. The nervous system suffers substantially. Without adequate vitamin E, nerve cells become far more vulnerable to oxidative damage, making diabetic neuropathy progressively worse over time. Your kidneys struggle as well, since oxidative stress is one of the primary drivers of kidney damage in diabetes. Adequate vitamin E helps protect kidney tissue from that progressive harm. Vision loss can accelerate because vitamin E protects the blood vessels in your retina. Without sufficient levels, diabetic retinopathy progresses faster. Cardiovascular health is profoundly affected. Vitamin E helps keep arterial walls flexible and resilient, reduces chronic inflammation, and prevents cholesterol from oxidizing, the process that allows it to embed into arterial walls and form dangerous plaques. This lowers risk of heart disease, heart attacks, and strokes. At the cellular level, vitamin E functions like protective armor. It stabilizes cell membranes and preserves essential fats inside your cells, keeping nerves, muscles, and blood vessels structurally strong and functional. It also improves insulin sensitivity by reducing inflammatory signaling and helping glucose move into cells more effectively. Another major benefit that often gets overlooked, vitamin E regenerates other antioxidants like vitamin C after they've been used, strengthening your body's overall antioxidant defense system. Without adequate vitamin E, cells become structurally weaker, more inflamed, and increasingly prone to damage, which dramatically accelerates diabetes complications. Fortunately, there are abundant natural ways to increase your vitamin E intake through food. Sunflower seeds are one of the absolute best sources. Just 1 ounce, 28 grams, provides approximately 66% of your daily requirement. Almonds are another excellent option, delivering around 48% per ounce. Hazelnuts provide roughly 28% per ounce, making them a convenient portable snack. If you prefer vegetables, cooked spinach delivers about 20% of daily intake per cup. Avocados are another valuable source, providing approximately 15% per medium-sized fruit, plus they contain the healthy fats needed for optimal vitamin E absorption. If you enjoy preparing gourmet meals, certain high-end dishes are exceptionally rich in vitamin E. A Mediterranean-style grilled sea bass with an almond and herb crust, 180 grams fish, quarter cup almonds, delivers over 70% of daily needs while also providing heart-protective omega-3 fatty acids. A Japanese roasted duck breast with hazelnut miso glaze, 200 grams duck, quarter cup hazelnuts, provides around 65%, offering rich, complex flavors along with powerful antioxidant compounds. A French-style avocado and sunflower seed tartare with truffle oil, 150 grams avocado, 2 tablespoons sunflower seeds, supplies approximately 60% of daily vitamin E in a nutrient-dense, luxurious dish. If dietary intake proves insufficient, high-quality supplementation can help. The most important distinction is choosing natural vitamin E, D-alpha-tocopherol, which is absorbed and utilized far more effectively than synthetic versions, DL-alpha-tocopherol. Pure encapsulations, vitamin E, 400 IU per softgel, is a top-tier option, offering potent, highly bioavailable natural vitamin E. Another solid choice is Now Foods Vitamin E, 400 IU per softgel, which includes a balanced mixture of tocopherols for comprehensive antioxidant support. Most people with diabetes benefit from 200-400 IU daily, but it's important not to exceed recommended doses without medical supervision, as excessive vitamin E can have blood-thinning effects that may interact with certain medications. Some dietary patterns and habits can actually worsen vitamin E deficiency, so awareness helps. Highly processed vegetable oils like soybean and corn oil increase oxidative stress throughout your body and deplete existing vitamin E stores. Diets high in refined carbohydrates and added sugars promote inflammation, forcing your body to burn through vitamin E at accelerated rates. Alcohol consumption damages liver tissue, reducing your ability to store and utilize vitamin E efficiently. Very low-fat diets can be problematic because vitamin E requires dietary fat for proper absorption. Even cooking methods matter. Overcooking vegetables destroys much of their vitamin E content, so lightly steaming or consuming them raw preserves maximum nutrient value. Vitamin E plays a massive role in protecting against diabetes complications, but most people have absolutely no idea they're running chronically low. It helps insulin work more effectively, protects nerve tissue, keeps blood vessels flexible and healthy, and reduces systemic inflammation. If your blood sugar has become harder to manage, nerve pain has intensified, or your skin feels persistently drier than usual, you might need substantially more vitamin E. Getting adequate amounts through strategic food choices or high-quality supplements can improve circulation, strengthen immune function, and make your body significantly more resilient against diabetes complications. Vitamin 3. Vitamin C. Vitamin C isn't something most people actively think about until they're dealing with obvious deficiency symptoms. For people with diabetes, inadequacy happens far more frequently than you might expect, and for very specific metabolic reasons, Elevated blood sugar burns through vitamin C at an accelerated rate because glucose and vitamin C actually compete for the same cellular transport pathways. When there's excess sugar in your bloodstream, vitamin C simply doesn't get absorbed into cells as efficiently. You could be consuming adequate amounts but still become functionally deficient at the cellular level. Additionally, people with diabetes experience significantly more oxidative stress throughout their entire system, so the body requires extra vitamin C continuously just to neutralize that damage. And since vitamin C is water-soluble rather than stored long-term, frequent urination, common with elevated blood sugar, flushes it out rapidly, making deficiency even more likely. Low vitamin C doesn't always present with dramatic, immediately obvious symptoms initially. If you're experiencing persistent, unexplained exhaustion, it might be because vitamin C plays essential roles in cellular energy production. Bruising very easily or noticing that minor cuts and scrapes take unusually long to heal properly. That's a sign your body isn't producing adequate collagen, which vitamin C is absolutely crucial for. Bleeding gums when you brush your teeth, persistently dry skin, and catching every circulating illness are all potential indicators. Joint pain and stiffness might worsen because vitamin C helps protect cartilage tissue from breaking down. In more severe deficiency cases, you can develop iron deficiency anemia, since vitamin C is needed for iron absorption, causing dizziness, profound weakness, and pale skin tone. Being chronically low on vitamin C doesn't just make you feel generally unwell, it impacts major body systems in specific, measurable ways. Fertility in both men and women takes a substantial hit. Vitamin C protects reproductive cells from oxidative damage. In men, it supports healthy sperm production and motility. In women, it supports normal ovulation and hormonal balance. Inadequate levels make conception significantly more difficult. Sexual function declines because vitamin C plays important roles in healthy blood circulation, absolutely key for normal sexual response. The nervous system struggles without adequate vitamin C. People with diabetes already face elevated risk of nerve damage, and without sufficient vitamin C, neuropathy symptoms typically worsen progressively. Kidney function becomes more compromised. The kidneys rely on vitamin C to combat inflammation and oxidative stress, and deficiency increases risk of diabetic kidney disease progression. Eye health suffers considerably. Vitamin C protects the tiny blood vessels in your retina, and low levels can accelerate vision loss in people with diabetes. But the most significant impact is on cardiovascular health. Vitamin C keeps arterial walls flexible and resilient, reduces chronic inflammation, and helps prevent arterial plaque formation. Without adequate levels, blood vessels stiffen, blood pressure rises, and risk of heart disease, heart attacks, and strokes increases substantially. At the cellular level, vitamin C functions as a powerful antioxidant, protecting cells from damage caused by chronically elevated blood sugar. It lowers oxidative stress, a major underlying cause of insulin resistance, and supports collagen production, which keeps blood vessels structurally strong, skin healthy, and tissues repairing properly. It also strengthens immune function by helping white blood cells fight infections more effectively. Another crucial role, vitamin C regenerates other antioxidants like vitamin E after they've been oxidized, maintaining your body's entire defense system. Without adequate vitamin C, cells become progressively more inflamed, age faster, and function less efficiently, accelerating diabetes complications significantly. The encouraging news is that it's relatively straightforward to obtain sufficient vitamin C through strategic food choices. Kakadu plums are the absolute highest natural source. Just 100 grams provides over 3,000% of the daily requirement, though they're not widely available outside certain regions. Acerola cherries are another powerhouse, delivering approximately 1,600% per 100 grams. Red bell peppers are an accessible, affordable option providing about 200% per 100 grams. Kiwi fruits offer around 150% per 100 grams. Strawberries provide roughly 90% per 100 grams, plus valuable fiber that helps with blood sugar management. If you enjoy preparing gourmet meals, certain high-end dishes are extraordinarily rich in vitamin C. A tropical ceviche made with fresh kakadu plums, citrus-marinated salmon, and red bell peppers delivers over 2,000% of daily needs in just a 150-gram portion. A Japanese yuzu-infused tuna tartare with kiwi salsa provides over 1,000% per 180-gram serving, offering refreshing acidity and umami complexity. A French-style acerola cherry sorbet with dark chocolate shavings, 120-gram portion supplies over 800% of daily vitamin C, while satisfying sweet cravings without spiking blood sugar. If dietary intake proves insufficient, supplementation can help, but absorption matters significantly. Liposomal vitamin C is one of the most bioavailable forms because it enters your bloodstream far more efficiently than standard ascorbic acid. Live-On Labs. Liposomal vitamin C, 1,000 milligrams per packet, is a premium option for maximum absorption. Another solid choice is Pure Encapsulation's ascorbic acid capsules, 1,000 milligrams per capsule, which provides a straightforward, effective dose. Most people with diabetes benefit from 500 to 1,000 milligrams daily, though during illness or periods of high oxidative stress, temporarily higher doses may be helpful. Certain habits and dietary patterns can actually worsen vitamin C deficiency substantially. Consuming too much added sugar blocks vitamin C from entering cells effectively, so high carbohydrate diets make it significantly harder for your body to utilize what you consume. Alcohol depletes vitamin C stores while simultaneously increasing oxidative stress. Cooking vegetables at high temperatures destroys vitamin C content, so steaming lightly or consuming them raw preserves maximum nutrient value. Smoking is particularly problematic. It burns through vitamin C rapidly, leaving your body chronically depleted of this critical antioxidant. Heavily processed diets lacking fresh fruits and vegetables make it nearly impossible to maintain stable, adequate vitamin C levels. Vitamin C represents one of the most accessible, straightforward ways to strengthen immune function, improve insulin effectiveness, and protect cardiovascular health. It helps prevent complications like progressive neuropathy, kidney disease, and vision loss. Whether you obtain it primarily through food or supplement with high-quality products, ensuring adequate vitamin C intake can create genuine, measurable improvements in diabetes management and overall health resilience. If you've been dealing with frequent infections, unusually slow wound healing, or constant fatigue that doesn't improve with rest, chronically low vitamin C could be a significant